September is officially Thyroid Cancer Awareness Month, making it the perfect time to focus on this vital gland in our bodies. Many people don't think of their thyroid until something goes wrong. However, keeping your thyroid healthy all year long should be a priority for everyone. Here with tips on how to keep our thyroids functioning at the best possible level is Dr. Celina Nadelman. Thanks for joining us. Talk about the thyroid's function in our bodies.
Thank you for having me. Well, the thyroid is actually responsible for a whole host of things in your body. It's responsible for your metabolism, growth and development of our children, hair, skin, and nail development. It's also responsible for proper heart function, brain development, and the strength and growth of our bones.
Yeah, so a lot of things are connected to our thyroid. Since Thyroid Cancer Awareness Month is September this month, why is it important that we bring awareness to the health of our thyroids?
Well, it really controls a lot. In addition to metabolism, a lot of things can actually go awry with your thyroid. Many people experience hypothyroidism, which is low thyroid. With that, people can find that they've been gaining weight unexplainedly. They have cold intolerance, they're lethargic, they have the loss of hair at the ends of their eyebrows. Or sometimes people are hyperthyroid, which means that they have too much thyroid hormone and they're feeling irritable, they're too hot, they're experiencing insomnia. And that is easy to find out if you're hypo or hyperthyroid with a simple blood check.
Oh, very interesting. Talk about where is that thyroid located? It's somewhere here in our neck area?
Yes. So the thyroid is just underneath the skin on top of your trachea. And sometimes if you've noticed, if you've gone to a physical exam, your doctor will be feeling for the thyroid and ask you to swallow because the thyroid moves up and down as you swallow. And if it's enlarged, called goiter, you'll start to see enlargement of your neck. And in the old days, if you've seen any old European paintings, you would see a European accordion collar called the ruff, and that became a fashion statement because a lot of people back then had goiter.
Oh wow!
And that, yeah,
that's very interesting.
That was actually due to lack of iodine.
Oh.
So thyroid needs iodine to properly function and make thyroid hormone, which controls your metabolism along with all the other things that I just mentioned.
I wanted to actually mention or ask. How do our diets affect thyroid?
So iodine, we don't make iodine. We have to get it from our foods. In the United States, because there was so much goiter, they actually started putting iodine in our salt in the early 1920s, so that most people in the United States were not getting enough iodine in their diet, and now they're getting much more iodine in their diet, and there's a lot fewer cases of goiter. However, in things like salty foods or seaweed, these are obviously high in iodine. But you can have obviously too much iodine. It's good to just make sure that you're having a healthy diet. In addition,
and like you said, it can definitely affect, weight gain in a lot of people. Now, how can we check our thyroids on our own? I mean, can we check for lumps around our necks, or do we need to go have a professional look at it?
Well, sometimes you can check your own thyroid by tipping your head back and taking a sip of water and looking at it in the mirror to see if you have any lumps or bumps. But if you are concerned about it, you should see your health professional and they can do a proper thyroid exam. In addition, if they are suspicious that you might have a thyroid nodule or a lump in your thyroid, you can go get an imaging test called an ultrasound, which is pretty inexpensive and pretty specific in finding thyroid nodules. About 3 million cases of thyroid nodules are found in the U.S. per year, but only 52,000 of these are new cancers. And so there's really, most thyroid nodules are benign. There's only about 4 to 6% of thyroid nodules that are cancerous.
So how common would you say is it for someone to suffer from thyroid disease?
I'd say over 3 million. I'd say there are a lot of people who go undetected, and for instance, thyroid nodules are detected while having an MRI for neck pain, something that's incidental. But usually, like thyroid hormone imbalances are found from your regular blood test that your primary care physician.
But if they find an issue with your thyroid, it is something that can be treated before it gets to be an extreme problem.
Yes, it can be treated. And oftentimes what happens after the ultrasound detects and pinpoints where the thyroid nodule is, you can go and get a biopsy called a fine needle aspiration, which is where I come in. I'm actually a board-certified cytopathologist, which is a type of pathologist that performs fine needle aspirations. It's this tiny little needle that's put into through the skin into the thyroid nodule in question using ultrasound as guidance. It's a pretty easy and relatively painless procedure, and a lot of different doctors actually can perform fine needle aspirations. However, things like doctors like radiologists, endocrinologists, ENTs, and surgeons, but they're not pathologists, so they can't actually read the slides afterwards. So I'm kind of like a one-stop shop. I see, I do biopsy, I do the diagnosis. I actually make the diagnosis.
Very interesting. Yeah. Well, this is really great information about the thyroid. Thank you for joining us, Dr. Nadelman. And we're going to post this segment on our website at yourcalifornialife.com. So in case you missed anything, you can get those thyroid tips there.